Welcome to the Module 8 on palliative care for non-communicable diseases. Palliative care is an approach that improves the quality of life of patients and their families who are facing problems associated with life-threatening illnesses such as chronic cardiovascular diseases, cancers, chronic respiratory diseases, chronic kidney diseases, etc. Palliative care prevents and relieves suffering through early identification, correct assessment, and appropriate interventions for treatment. Palliative care begins at the time of diagnosis of a life-threatening disease and continues throughout the disease process until death and into the family's bereavement period. It is a right of every person with life-threatening illness to receive appropriate palliative care wherever they are. It is also a responsibility of every healthcare professional to practice palliative care according to the need. With the population aging and increased deaths due to non-communicable diseases, it has led to the increasing demand of palliative care services. Therefore, I would like to invite you to be empowered with basics of palliative care. Thank you.
Palliative care for non-communicable diseases. Delivery of palliative care is an essential component of comprehensive care for non-communicable diseases. At the end of this module, you should be able to define palliative care, identify NCDs which need palliative care, understand key concepts of palliative care, identify palliative care needs of the patient and caregiver, describe key domains of delivery of palliative care, describe palliative care delivery settings, describe policies and strategic framework for development of palliative care for NCDs in Sri Lankan setting. Understanding above thematic areas will be helpful for you to appreciate palliative care as a part of NCD care and will motivate you to further explore palliative care in the future. World Health Organization defines palliative care as mentioned in the slide. Palliative care is an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Each bold word or section in this definition gives a very strong meaning. An approach, a method beyond medical model extending to social dimensions. Quality of life of patients and their families. Objective is to ensure quality of care to both the patients and family members. Life-threatening illness. Even though palliative care is evolved in the field of cancer care, palliative care needs to be provided not only for cancers, including other non-communicable diseases. The prevention and relief of suffering, if possible, need to prevent occurrence of symptoms as well as relief of symptoms if symptoms arise. Early identification and impeccable assessment. The problems or needs have to be identified early and correctly or definitely. Treatment of pain and other problems, physical, psychosocial, and spiritual. Palliative care is not only provision of care for physical symptoms, it addresses the care for all four domains, leading to holistic care. Terms related to palliative care are usually used interchangeably but have distinct meanings. End of life care. Care during last few months or days of life when a person is irreversibly dying. Healthcare not only of patients in the final hours or days of their lives, but more broadly, care of all those with a terminal illness or terminal disease condition that has become advanced, progressive, and incurable. Hospice care, a model of delivery of end of life care. Terminal care, care provided during the phase of dying. Non communicable diseases which need palliative care include chronic cardiovascular diseases, example chronic heart failure, cancers, chronic kidney diseases, chronic respiratory diseases, chronic neurological diseases, chronic liver diseases, and end-stage diabetes mellitus. Key concepts of palliative care include following principles. Palliative care affirms life and regards dying as a normal process, intends neither to hasten or postpone death, provides relief from pain and other distressing symptoms, integrates the psychological and spiritual aspects of patient care, offers a support system to help patients live as actively as possible until death, offers a support system to help the family cope during the patient's illness and in their own bereavement. Palliative care uses a team approach to address the needs of patients and their families, including bereavement counseling if indicated, will enhance quality of life and may also positively influence the course of illness. It is a right of every patient who is suffering from life threatening illness. It is a responsibility of everybody to provide palliative care for those who need it. Evolving model of delivery of palliative care. In previous model, palliative care was offered if active treatment failed and provision of palliative care was ended when death of the patient occurred. In current model, palliative care needs to be commenced with the diagnosis of life-threatening illness, and it is offered in parallel with curative treatment. The proportion of palliative care increases with the progression of disease. Also, palliative care is extended beyond the death of the patient into the bereavement period for the bereavement care for the family members. Assessing palliative care needs of the patient. Palliative care needs of all four domains have to be assessed, and clinical evaluation needs to be conducted to understand the total needs of the palliative care patient for intervention at the beginning of follow-up care provision. Interventions for palliative care needs to be addressed in all four domains: physical, psychological, spiritual, and social. Assessing palliative care needs of family caregiver is important since palliative care looks into the caregiver's well-being too. Caregiver needs may be information needs, those that are illness related, treatment related, caring for the patient, caregiver training, respite care for burnout or fatigue or stress, timely attention to illnesses of the family member, psychological support, social and financial support, spiritual support. Palliative care can be delivered at any setting. 3H: hospital, hospice, and home. Hospital, tertiary, and secondary care hospitals with consultants, primary healthcare institutions, OPD setting, family practice setting, hospice, and home. When delivery of palliative care in hospital setting are considered, only small number of patients need specialist palliative care throughout the illness trajectory. Some patients may require assistance of specialist palliative care occasionally, and other times can be managed at the primary care. Most patients can be managed at primary level palliative care all the time without needing specialist palliative care. Primary level palliative care may be offered at the primary care or at the other specialist level. Example, cardiology clinic level, oncology clinic level. Hospice care is a type of health care that focuses on the palliation of a terminally ill patient's pain and symptoms and attending to their emotional and spiritual needs at the end of life. Hospice care prioritizes comfort and quality of life by reducing pain and suffering. In Sri Lanka, also, several hospices managed by non governmental organizations and are functioning free of charge. After the active treatment is over, patients are recruited for the hospices through the treating consultant. Some of the functioning hospices available in Sri Lanka are Shanta Sevana Hospice, Maharagama, Satya Sai Sevana, Hangwalla, Kane Hospice, Jaffna, Cancer Care Hospice, Anuradhapura, Eastern Cancer Care Hospice, Iravur. When palliative care patients are cared at their own home by a trained healthcare team and family members, it is called home care for palliative patients. Ensuring the quality of life of patients and their family members is the main goal of home care. Public health nursing officers are attached to the selected primary medical care institutions of the Ministry of Health. One of their tasks is provision of home based care for palliative care patients living in his or her designated catchment population of the PMCI. They are trained in identifying physical, psychological, social, and spiritual care needs of these palliative care patients. According to the need, PHNOs will schedule home visits and provide necessary care with the guidance of medical officer in charge of PMCI. When palliative care is provided at the community, center of care is the patient. Caregivers and family members need to be supported by the health and non health personnel to provide comfort care for the palliative care patients. Palliative care in the Sri Lankan context. Palliative care has been identified under the broad strategic direction of promotion of equitable access to quality rehabilitation care at the Sri Lanka National Health Policy 2016 to 2025. It is mentioned that the mainstream health system should provide palliative care to all patients who need such care for them to live and die with dignity. In addition, palliative care is identified as continuum of care of several other policy documents in Sri Lanka, including National Policy and Strategic Framework for Prevention and Control of Chronic Non-Communicable Diseases 2010, National Policy and Strategic Framework of Prevention and Control of Cancers 2015, and National Elderly Healthy Health Policy 2017. In 2019, Ministry of Health launched a 5-year strategic framework for palliative care development in Sri Lanka for year 2019-2023, following detailed consultation with all stakeholders, including civil society. Following 11 strategies were identified. 1. Include palliative care as an essential component of comprehensive health care. Integrate palliative care services at all levels of care, tertiary, secondary, primary, and at community level. Ensure availability of skilled multidisciplinary human resources for delivery of palliative care services at institutional and at community levels. Develop and adhere protocols and guidelines in palliative care. Ensure availability of drugs and technologies for provision of palliative care at all levels, tertiary, secondary, primary, and community level. Build partnerships with government and non governmental organizations for delivery of palliative care. Empower family members and caregivers for the provision of palliative care. Encourage research related to palliative care. Ensure adequate financing and resource allocation for cost effective delivery of palliative care. Facilitate strengthening legislative framework for delivery of palliative care. Monitor and evaluate palliative care delivery at all levels of care. The major activities identified in each strategy is documented at the National Strategic Framework for Palliative Care Development in Sri Lanka for year 2019-2023, which is available online. The website is www.nccp.health.gov.lk. To further strengthen your understanding of palliative care, try to answer the following questions based on the discussions up to now. What are the main goals of delivery of palliative care? List common non-communicable diseases which need palliative care. Palliative care needs to commence at the point of diagnosis of life-threatening illness and extends beyond death of the patient. What do you understand from the above statement? How do you categorize palliative care needs of a patient with non-communicable diseases? Describe different settings for delivery of palliative care. If you need further details of palliative care from policy level to service development and clinical care, please read the publications given above.